Hello and welcome to Our Voices. I am Semenyu Shekoye, joined by my colleagues Oriane and Amina. Hello ladies.
Hello.
We are all wearing pink today, and I don't think it's a coincidence.
No, it's not. This is Breast Cancer Month, and we're going to be talking about the health of our breasts.
You know, yesterday I said to my sister, I have a show on breast cancer. Do you please have anything pink to borrow me?
Yeah, well, we all consider pink to be that soft, gentle color, and it kind of represents like the hope of the future. So we wear pink to show solidarity for breast cancer awareness month and also for people who are affected by breast cancer.
So get your ribbons, people.
Get your ribbons, and I love the fact that we can actually talk about it, at least have a month for it where we actually really focus on this issue, because I think a lot of us women really don't take the time to do what we need to do to keep it healthy.
Especially, women of color, you're so involved with your day-to-day lives that you really don't think about your own health. And it's really, really important to pay attention to yourself.
Exactly. Breast cancer is the most common cancer worldwide. However, research indicates that women of African descent are more likely than white women to be diagnosed with breast cancer. According to the American Cancer Society, as of 2019, breast cancer is the leading cause of cancer deaths for Black women. Biology, healthcare delivery systems, and other social, economic, and cultural reasons contribute to this disparity. But despite its higher mortality rates, breast cancer still does not receive enough attention from healthcare community and society in Africa. October is Breast Cancer Awareness Month, and on this episode of Our Voices, we are looking at why it's important for women across Africa to pay special attention to breast cancer. We will hear from experts about the need for early detection and talk about latest technologies and innovations that help with treatments.
A widely used and convenient form of early detection for breast cancer is the self-examination. This is an inexpensive and non-complex screening method, but studies show this practice across Africa is currently inconsistent. Let's hear from women in Ghana and Malawi to assess the awareness and practice of breast self-examination.
So when you wake up in the morning, you have to check your body, you have to undress yourself and massage your breast and see if you can see any lump or any disturbed things in your breast. We are aware, mostly we see it on telly, we hear it on radio to go for checkup.
Sometimes when I wake up in the morning, I touch my nipple and feel it. If there is some pain somewhere, that is how I do to check my own.
Do you know how to do it?
No.
How often does you check yourself?
Every 3 months, or sometimes when I visit to the hospital, I check.
Yes. When you wake up in the morning, you raise up your hand and use your finger to massage your breast. If there's any pain or if you experience any strange pain, then you see a doctor.
I have been tested for breast cancer before. I protect myself by not keeping money in the bra near my breast to prevent myself from having breast cancer. I have never had a safe breast cancer examination, but I have heard that people do this.
To protect myself, I'm supposed to massage my breast to ensure that there's nothing wrong with my breast. I do this every month. We need to go to the hospital to get examined for breast cancer. I massage the breast at least every month. If one notices a lump or some pain, there's need to go to the hospital.
I protect myself by not buying and consuming processed foods with preservatives from shops. Such foods may cause cancer in women. I have heard that women can do self-breast cancer examination. As women, we are taught to do self-examinations so that when we notice something strange, we should seek medical attention. The examination is done by massaging the breasts. If there are lumps, we are supposed to seek medical attention. It could be cancer.
I do remember the last time I did breast self-exam. Do you?
I agree with you. I think a lot of women really don't. They hear the good advice and the tips that, we need to check our breasts. But I fall into the category, and I'm really guilty of this, of hearing the advice, but not really regularly consciously examining my breasts, because sometimes you're massaging yourself because you're tired at the end of the day, but consciously checking for things. I'm guilty of not doing that, and I need to really do exams.
I think we all are.
I think I'm as guilty as both of you. The only contact I have is when I'm adjusting my bra.
Well, you're worse than me.
And then once a year when I do the mandatory physical, of course my doctor checks me, but that's about it.
Yeah.
So what do you say, ladies? Let's make a pledge here, now, today.
Yes.
Once a week, something realistic, not
really
every day.
convicted.
Exactly. I mean, I share everything you said, but the apparent lack of knowledge of screening and treatment appears to be responsible for many of the deaths from breast cancer in Africa. So to take a deeper look into this, we invited two experts to our program. Dr. Melissa Durand is Associate Professor of Radiology and Biomedical Imaging, and Dr. Augustina Badu Pepra is Head of Radiology Directorate. They both work with the RadAid NGO that takes radiology to low resources areas, including many African countries. Both are joining us by Skype. Thank you very much for being here today. Dr. Durand, let me start with you. We just heard from women in Malawi and Ghana about how much they are aware about breast self-exam, how often they do it, and it seems that we all have different understanding. So please tell us, how early should a woman start to do breast self-exam, and how often should we do it?
Sure. So, there's not a strict rule, but it is often said, start doing your breast self-exams. You could start at age 20. And basically, the idea is to get an idea of how your breast feels so you can be aware if something arises that's new. So you could start at 20 and maybe once a month in the shower, just get to know what your body feels like. And you can continue this. We usually start screening in the US at age 40 with mammograms. That can be a little bit harder to do in Africa, where ultrasound is a little bit more available. So you could do that instead. But age 20 for breast self-exams would be a good starting goal. And I think that's great that you guys are trying to make a pledge to.
Yes, we will. We definitely will. I think we have to be accountable. We have to have an accountability partner sometimes to really do what you need to do. And I'm going to turn to Dr. Badu Pepra. And both of you were on our show last year, and you were both and you helped us to understand things a little bit better. You told us that in Ghana there was a 4.5% of breast cancer prevalence and rate of women who had to wait for a long time to get treatment, resulting in high mortality rate. Has anything changed since last year, Dr. Badu Pepra?
Yeah, thank you very much. Since last year, we have increased number of people now coming to the clinic for screening. And we now are having increased numbers of the breast cancers. So now we have our estimates as being like 19 to 23% for all cancers and 32 to 39% for female breast cancers. So the mortality is very, very high because the diseases we are still not catching them as early as we want them to. So we are still catching them at stage 3 and stage 4. So we are still have a very high mortality rate. Our overall survival for the 5 years, those that are able to come early, that's the stage 1, are having like 92% survival. And then the stage 4 is having about 15% survival with an overall cumulative survival of 48%. We still don't have a national screening program. And we still have the awareness and opportunistic screening. And with that, we are having about 2% of people coming for mammography. 12% are coming for clinical breast examination. And from interviews, we realized about 32% are doing self-breast examinations.
Yeah, those are very, very good numbers. So, Dr. Durand, I have a question for you. I also remember that you run fellowships where you train radiologists and surgeons in Ethiopia and Ghana on screening and examining breast cancer at an early stage. Is this fellowship bringing any change to early detection?
So the last time we talked, we were just starting to organize that, and I'm working with Dr. Badu Pepra to start that first fellowship in Ghana. So we did a trial run of that this year, doing lectures and live Q&A sessions. The formal fellowship curriculum is under review right now, and we hope to start the official fellowship in January. So we're hoping that this will increase the expertise of the radiologists in the country, and that will help early diagnosis of breast cancer.
Thank you so much. Thank you so much, Dr. Durand. Stay with us. We are discussing with Dr. Melissa Durand and Dr. Augustina Badu Pepra about the disparity of breast cancer and the need for early screening. We're going to continue the discussion with them in a minute, but it's time for a break. But first, please visit us on our social media platforms and share with us what you know about breast cancer and how accessible information about prevention, early detection, and other medical resources is in your community. We are on Facebook at VOA Africa, and our Instagram and Twitter handle is at VOA Our Voices. We're also on WhatsApp. Our number is US country code +1 202 503 9025. We'll be right back.
And in upcoming episodes, we will bring you a conversation on family structure in Africa. We will also invite an expert to the show to talk about the latest trends in some parts of Africa, moving from large communal families to small family, also known as a nuclear family structure. Please share with us what you think. Do you prefer a big family with a community setting or small family with only parents and kids? Please share your thoughts with us on our social media platforms. We'll be right back.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Lina Khmoudou, in Washington every week on Healthy Living, right here on VOA.
Welcome back. You are watching Our Voices. Today we are discussing how breast cancer especially affects women of African descent. Hard data on cancer in Africa is scarce. While more than 17% of the world's population calls the continent home, only 2% of genomic study participants are of African descent, according to the US Department of Health and Human Services. But recently, a diagnostic startup in Accra, Ghana, may soon change African cancer studies forever. Let's take a look.
In the open-air kitchenette of a small research clinic in Ghana's capital, Accra, pathologist Kafui Akakpo carefully carved a piece of cancerous breast tissue into a sample smaller than a matchbox. Hundreds of samples bobbed around him in plastic jars of formaldehyde. But this one would soon begin a journey across town to Yamati Biotech, a homegrown research and diagnosis startup that Akakpo thinks could change African cancer studies forever.
Even though breast cancer has been studied extensively throughout the world, the truth is that most of the cases are not Africans. If you look at every study across the world, there are very few of them who are Africans. So what this does is that you come to the African population and study it, and that has effects on African Americans and any other group that has a basis in Africa. That's why this is so important. Without it, you don't have enough to relate to African breast cancer. Most of it is actually in a white population and not in an African population.
Hard data on cancer in Africa is scarce. While more than 17% of the world's population calls the continent home, only 2% of the genomic study participants are of African descent. This according to the US Department of Health and Human Services. Yo Bediako, the chief executive and co-founder of Yamati Biotech, says the startup looks to construct a first-of-its-kind genomic archive of cancers in Black people from around the world.
The reason Yamati is focused on cancer is partly because no one else is looking at cancer in Africa. All our research, or majority of our research, is focused on infectious diseases. And yet we have one of the world's fastest growing burdens of cancer. And we have some of the highest cancer mortality rates anywhere in the world. So as much as HIV and malaria are problems, cancer is a huge problem, and it's actually a problem that is growing faster than those other problems. So I felt that for a new company starting out, we needed to focus on an area that was really important, but also was less traveled.
After emerging from Silicon Valley's prestigious Y Combinator fund at the dawn of the pandemic, Yamati's Ghanaian founders quickly established what has become the most advanced genomic research laboratory in Ghana. As one of the country's only labs equipped for molecular analysis, Bediako's team have tasked themselves with collecting data they believe will aid the development of precision medicine for cancer patients throughout the continent and diaspora. Akakpo is aiding in a study of the various kinds of breast cancer affecting Black women, who according to the breast cancer prevention partners are disproportionately exposed to the disease. Another will aim to sequence every type of childhood cancer in Ghana later this year. Yamati also recently launched Ghana's first home testing kit for human papillomavirus, one of the leading causes of cervical cancer. The American Cancer Society estimates that more than a third of global cancer deaths occur in Africa. Investors are taking note. In just over a year, Yamati has raised around $3 million in seed funding, mostly from African investors. That's not including the $1 million grant provided by the Bill and Melinda Gates Foundation to investigate responses to COVID-19 vaccines in Ghanaian adults.
Well, we just heard that only 2% of people from African descent are included in cancer research around the world. Dr. Badu Pepra, let me come to you. You just heard what's the startup and the initiative in Ghana. What do you think about having such initiatives in the continent? How important is it having such researchers in Africa?
And looking at the cancer rates in Ghana, it's important we have this research because it's through research that we will know exactly what to do to help us improve our cancer management. Prior to these studies, we didn't know we're having lots of the triple negatives and we're having our young ones having the cancers and dying early. But with this research work, we've noticed the shortfalls and then the common cancers in our setup and how to appropriately manage them. Currently, in two of our cities, that is Kumasi and Accra, we have the full-fledged services available for diagnosis, the surgery, as well as the management, including even palliative care, so that those that are, come in very late stage are still managed to have a very peaceful death. But this research is really going to help us and has started already helping us to improve our cancer management when it comes to breast cancer.
Dr. Durand, we're looking at how, malaria and HIV are really, they have a lot of resources, and maybe because the data is there, what can governments do to really step up their game in terms of like adding more resources, and maybe prevention can be really focused on because I think a lot of the countries haven't been putting a lot of resources, maybe because of the lack of the data of how prevalent is breast cancer.
Sure, I think that's a great question. I think a lot of the reasons why there hasn't been as much research done in the African population is because there's no screening program. So when you're doing these research studies, it's important to canvass the whole population so you understand what's the incidence of the breast cancer and what subtypes are coming up. So if you're only getting sporadic bits of information because women are only coming in when they're symptomatic, then you're not getting a whole picture of the spectrum of the disease. So I think from a government standpoint, funding into screening programs so that women get regular screenings and as many women as possible, then you have that population that you can really start to build reproducible research on. But I think this startup is really a great start in that respect.
So, Dr. Badu Pepra, I have a question for you. What would you say to the young African woman who looks like you and believes in you and what you're doing, but is afraid of getting her breast cut, and so is ignoring symptoms that she knows she can feel?
Well, in Ghana, we're doing more education, more advocacy, and then I think basically that's what we're doing. So I think with that, and as they see cases, we also make survivors also come on radio to educate so that they realize that keeping your disease is not going to help you. The outcome is not good, but coming out with your illnesses will help you improve yourself or get better so you can take care of your family. So basically, we're doing more of education, advocacy to encourage these ones to come out. And I think it's helping and people are getting more aware of the presence of breast cancer.
Dr. Durand, do you say that the fellowships you are offering, the trainings for the surgeons and the radiologists as you do in Ethiopia and Ghana, do you think that contributes to improve the data available in cancer research in Africa?
I think if we can keep track of all the biopsies that are done, they can be accumulated in like a tumor registry, and that can help identify what cancers are being found and what their outcomes are, how patients do. So I think that can help. We're not quite there yet at all the sites, but there are definitely some sites in Ghana that already have tumor registries, and we can certainly contribute to that. And those biopsies that are done for these young women who are presenting with things, most of the time biopsies are okay. They're benign processes, and so better to be seen and treated.
Definitely. Our thanks to Doctors Melissa Duran and Augustina Badu Pepra for joining us today. After another break, we will introduce you to a Sudanese singer who is playing a key role in breast cancer awareness. That's in our Women to Watch report. Stay with us.
From around the world, let's go.
Welcome back. You are watching Our Voices. A popular Sudanese singer, Mona Magdi, was diagnosed with stage 2 breast cancer in February 2022. She's determined to fight it with music and love. That's next for our Women to Watch segment.
Having traveled to Cairo for treatment, Sudanese singer Mona Magdi was fighting both cancer and loneliness. She decided to go back to Khartoum because she realized that support from loved ones and fans is essential to her recovery. Getting on stage with a bald head and blowing kisses to her audience at a concert, Magdi said she is living the best days of her life. Seeing the audience cheering for me while I'm on stage is an indescribable feeling. I was so happy. It is one of the happiest things that has ever happened to me in my life. I'm thankful for this disease because it showed me how much people love me. I'm so happy with their love and support. In her spare time, Magdi hosts friends at home, where they sing and ululate. and visit children with cancer to offer moral support.
وجود الأصحاب أكيد يعني بيشيل منك إحساس الألم والهموم وأي حاجة. بالذات وجود الأصحاب
Having friends around makes you feel less pain, especially when you have family and friends in a good atmosphere, like singing and arts in general. The most important thing is to make yourself feel that you are fine, not suffering from any disease, completely recovered, to give yourself this strength from the inside, which will reflect on you from the outside. People around you will see this and will benefit from your powers.
تدي نفسك القوة دي من جواك، فبالتالي حتنعكس عليك من برا، والناس اللي حواليك حيشوفوها وممكن يستمدوا من قوتك دي. احنا هنا في استراحة.
We are at the residence for children with cancer. I'm very keen on visiting them because I know from my experience with cancer that psychological support is very important. It is almost the most important thing.
جدا جدا يعني كاد يكون في المقام الأول.
She also joins thousands of Sudanese anti-military protests who take to the streets to oppose a military coup that took place last year. Her song titled "This Country is Ours, Our Government is Civilian, and Free Sudanese, Free Country" fueled a revolutionary spirit among protesters who rushed to take selfies with her in a protest last week. Magdi was briefly detained by Sudanese authorities in 2018 for indecent clothing after she was spotted wearing trousers in a mall during a performance.
I really love the way she's using her global platform to really advocate for such an important cause. And one thing that I took away from that story is that she said the psychological support is so important, and I like that.
Yeah, she said that having people and friends makes it less painful, and that is very important thing.
What I admire the most is her ability to stand proud, bold, because I feel a lot of women, even when you feel like the symptoms are coming on, maybe you ignore it because you think, I'm going to lose my breast, I'm going to lose my hair, you know.
Yeah, and that brings us also to the end of our show today. We will see you again next week with another exciting program, but don't forget to continue the conversation on our social media platforms. Until then, thanks for watching.